Hello, I'm Michael Hainsworth. As Canadians kicked off the new year, the Federal Minister of Health wrote to us that Canadians are facing significant challenges when it comes to our healthcare system. Mark Holland cited investments to strengthen public health care, including $200 billion in bilateral agreements with the provinces and territories to expand family health and reduce backlogs. Minister Holland also cited the Canadian Dental Care Plan that aims to cover 9 million Canadians currently without coverage. But that program and other initiatives are at risk of cancellation if the Conservatives win the next federal election, and there's something in the polls that suggests it'll happen. And how will a petulant Donald Trump factor into the flow of medicine, equipment, and possibly doctors into Canada? Minister Holland joins us now alongside C.D. Howe Institute Associate Director of Research, Rosalie Wyonch. Thank you both for joining us.
Thanks for having us.
Always happy to chat, Michael.
And Rosalie, happy to chat from the back seat of a taxi cab, clearly. Didn't make it into the studio.
I didn't. Well, there was actually a medical emergency on my train this morning. And, transit options are what they are. So we make do, and here we are. But, the show must go on. So happy to make it work. And, just goes to show that even when you're perfectly healthy, the access to healthcare can disrupt your day for sure.
And the transportation system too. But Minister Holland, that's not your file, so we'll let you off the hook on that one. But you did write that healthcare delivery in Canada has had to evolve to meet the needs of Canadians. Patients now benefit from nurse practitioners diagnosing, referring, and treating patients, tasks historically handled by a primary care physician. It's that has had part I'm interested in. Do you think the evolution is over? And if not, how do you see Canada's healthcare system continuing to evolve over the next decade?
Well, thanks, Michael. I appreciate the opportunity to be here. Rosalie, I hope everybody was okay there. Sorry that you encountered that. Hope everybody was all right. Absolutely, our system has to continue to evolve. And it's an incredibly exciting time in health. Canada has an enormous challenge. We're one of the largest countries in the world. We have an incredibly diverse population with many different needs. And we have incredible tools that are coming to bear to be able to help Canadians with their health. So, when you look at where we're going, it's about prevention. It's about being upstream. It's about using tools to make sure that people have access to medicine, have access to primary care. About 70% of chronic disease and illness, Michael, is preventable. And so if you look at what's filling our hospitals, what's filling our emergency rooms, so much of it doesn't need to be there. And I think focusing on that is absolutely critical. The journey that we have on making sure that people have access to medicine, access to dental care, have access to the basic necessities of keeping themselves healthy, and you mix that in with an interoperable, interconnected data system that can deploy AI, it gives us tremendous opportunity to expand the advantage that we have. Canada has one of the longest health spans in the world. That is the length of time we live in health and not illness. That's an incredible advantage. We need to keep expanding it.
Now, Rosalie, you and your colleague Ting Ting Sheng have done a lot of research on the evolution of healthcare in this country. How do you see the private sector's involvement evolving?
Well, I think that it's been a really interesting time, and I'd say that while scope of practice for lots of professionals like nurse practitioners, pharmacists, the scopes have expanded so that they're able to deliver this care, but the provincial health insurance systems may not have included those services or created the structure for them to then provide publicly paid for services. And so there's just really been this really interesting evolution over the last couple of years where, because of this sort of gap between the scope that people are willing to or can practice to and what provincial insurance programs might actually cover, we've seen this growth in, privately paid for virtual care, nurse practitioner, private clinics that might be for-profit private pay. And so I just say, I think that we've seen part of a natural evolution, but it's been kind of, shall we say, unmanaged or disjointed, where some things are moving faster than others. And I just want to applaud Minister Holland for his boldness in actually trying to force the provinces to have the public insurance system catch up with our scope of practice evolution. And I'd say that, my views are that this growth within the private market has been natural. This is market demand. And because this gap was left with the provincial health insurance system, or people were having difficulty getting access, that a lot of people are accessing these channels, and it is filling a gap, but that the way that it's filling that gap might not really fit with what we traditionally think of in terms of our equitable healthcare system having universal access and those challenges. But realistically, compared to other countries, Canada does have an access challenge. And so in my view, anything we can do to address those access challenges, public or private payment, public or private delivery, matters less to me than can people access care, and that is a challenge that needs to be addressed.
Minister, you have a furrowed brow.
I do. I mean, look, I completely agree with the ability of folks being able to get access to care. I think as part of access is also affordability of care and making sure that people are in a circumstance where they can get the medicine they need, where they can get the care that they need, and they can get it in a way that that isn't affecting their bank account. Because when somebody walks in and they need care, I'll give you an example on dental care. We were announcing the 1 millionth person in Canada getting access to dental care, and I talked to a gentleman who said, this has been a huge, huge boon for me, because I went in, a long, long time ago. He didn't know how long ago. Maybe it was 10 years, maybe it was 15. And it had cost him so much money, a pain in his mouth, a problem in his mouth, that anything was going on in his mouth, he refused to go in. He says, I'm not going to deal with it. I know I can't afford it. And now he's going in and he's getting regular care. So dental care, people say, why are you so focused on dental care when we have access to primary care issues? Dental care is primary care. We're identifying oral cancer, we're identifying hypertension, we're identifying diabetes, and we're making sure that we're preventing problems before they become more serious. Diabetes medication, the same thing. So I want to, first of all, validate everything that Rosalie is saying. Absolutely, we have to have access to family health teams. We have to see expansion of scope. We have to be able to see pharmacists and nurse practitioners and midwives and everybody operating at top of scope. That's what our interpretation letter was about. And now we also have to make sure that that's within the rubric of a public system, that people are getting that care within a public system. And one of the reasons why, and we'll be discussing virtual care at the health ministers meeting, we need to broadcast into the market that where Canada is going is that this is all going to be in a public system, so that we don't see too much calcification around private infrastructure. Because if that private infrastructure takes hold, what I'm worried about is that this incredible opportunity to address the needs of particularly rural and remote communities, but everybody, is going to be left extremely inaccessible, because it's not going to be affordable for patients. And, we have a system that waits for people to get sick. It's an illness-based system. We need to be switching to a prevention-based system. And what we know, when people have access to care, when they have access to primary care, when they have access to medicine, when they have access to dental care, it not only improves health outcomes, but it radically reduces costs. This is the system that we need.
That I totally agree with. I think that the prevention and getting better access to primary care is totally it. And I want to just double down and underline that definition of primary care that isn't just a family physician. It includes the dentists, the pharmacists, the nurse practitioners, and actually so much so that the OECD definition of primary care, Canada's a bit unique in that we count physicians, only general practitioner physicians and family physicians, but other countries include a lot more kinds of practitioners in primary care. So I agree that this is part of the evolution, and maybe I'm just a bit more cynical, where I think that private infrastructure has really expanded out, and the public infrastructure did during the pandemic. But then, particularly on virtual care, it really got rolled back. And I mean, we absolutely should have reevaluated some of those things. They were done really quickly. You need to evaluate, ensure you're setting prices in the right way, and not making other unintended consequences. But I do think that, maybe that might be closing the barn door after the horse is already out. But I mean, that's that. I would also say that's totally open for argument, and it's not so calcified it can't change. I guess it's just, it's already there and a good thing. So I have a bit more of an additive view. But yeah, that's just maybe that's just me being cynical.
Well, Minister, then let's dig into that specifically. How do you open up Canada's healthcare sector to private interests without going down the path of the United States? What are the specifics you can say to a Canadian who's concerned about that end game?
Well, I think we have to encourage, support, help drive innovation and change within a public system. And we have, look, there's a lot of private interests and private operators inside of working within a public system. Take doctors as an example. They run an independent business, but they build a public system. It's essential that it really, I think, and maybe this gets to Rosalie's point, like when you walk into an office, a doctor's office, this is fundamentally what a Canadian cares about, I think. You walk into an office and you need care, whether it's a virtual office or a physical office. You don't want to be pulling out your credit card. And because we don't want a society where care is dependent upon how much money you have. That system doesn't work. Because what ends up happening is all of the money starts flowing to the private system. The private system is only interested in what it's going to make money off of. That's fair. That's reasonable. That's what it does. But the public system then is left with the most vulnerable, and it's left with less resources, and it's left with an inability to help people. And when you think about, because Rosalie's right, we've seen an explosion in virtual care, but it is a drop in the bucket compared to what's happening. When you take a look at what is going to be available in rural and remote communities, and I think specifically of the challenges that we have, very difficult conversations in First Nation, Inuit, and Métis communities, and talking about the deep challenges they have in healthcare. Virtual care is going to be an incredible tool for us to use for them. What a tragedy it would be that tool will be reserved for people who had money. Because what ends up happening, and you look at the reports that are saying, where's Canada behind? And I think it's fair to look at us, against other countries. But remember, one of the reasons we're behind is equity of access, equity of care, equity of outcomes. That is really driven by very vulnerable populations not getting the care they need. So I don't necessarily have a huge problem with some of the initial stuff that has started up. I want to see it though in a system where everybody has access to it and where it's being deployed in a public system to stop people being ill. And that if that distinction is one that we can agree on, then I'm not ideological about who's doing what. It's about the patient and about making sure that patient can afford the care that they need and they're getting it in a way and a time they need it.
But considering the provinces are the ones responsible for enacting health care in their region, you've already provided the carrot, $200 billion over several years. What's the stick?
The Health Act, the Canada Health Act is I don't like to I don't like follow the stick. I call it it's like the rail the train stays on. It's our center guiding pole that keeps us attached to public care and to the spirit that should pervade our public health system, which is that it's there for people when they need it, and we can make sure that all people, regardless of their income, are able to get the care that they need, that needs to be outside of the consideration of how much money you have. And so for me, the Canada Health Act, we have the interpretation letter. It's really important on scope because that interpretation letter that I just issued means that if somebody starts charging as a nurse practitioner in a private clinic for care, that we have a mechanism to move against that and say that that's not appropriate in our system. We're going to the health ministers meeting to have a conversation around virtual care. When do we put that into effect? How does it work? How do we allow the kind of flexibility that Rosalie was talking about, which I want: private investment, innovation, seeing it be dynamic, adopting technology as fast as possible, moving at a speed that, let's be honest, government is traditionally not known to move at, that we have to stay competitive. How do we do that within the rubric of a system that is public and accessible for everybody?
Can I actually just pause on that point? That that government needs to keep up. They need to be competitive because sometimes maybe our healthcare system isn't innovating at a systemic level or overall as much as we would like, even though there's pockets of amazing things happening. And maybe I just challenge and say, maybe that's what the private involvement is. It creates the challenge. The public system has to innovate. It has to keep up. And, I absolutely accept the argument about pulling resources out of the public system. But I would say that anyone that's paying for private care still pays their taxes. So they're actually paying twice. Now, in terms of how much labor we have, or is there going to be enough care available, the way that we can get a lot more care is by making as much care as possible more efficient. So getting people that access early so that they can get preventative services. Making sure that everything runs as efficiently as possible and that providers are going to the limit of scope. So I guess what I wanted to say is I think what I'm concluding is that we have the same goals. And it's not an ideological question, really. It's about how do we get there, and there are potentially different paths. And I'd maybe just say that in terms of whether or not it's a system that works, I think most Canadians can look at the United States and just say, we don't want that system. But there are many systems in Europe that have mixed public-private versions of fully private but publicly paid. And so there's a lot of different options for how you can get to the same outcome. But I think on what we are certainly agreed on is the goals, and there are potentially many paths to get there. And I just, being an economist first and foremost, the competitive engine of the economy and innovation is the most powerful driver that I know of. And I think that can drive the public system forward. But I do understand that people have very different opinions about that, but I got to put the economist point out there.
But I don't think these are, and sorry to jump in, Michael, but I don't think these things are at odds with one another. If we think about this and we say, look, in health, the amount of money and jobs that could be created in this is so astronomically huge that there isn't really any reason to be in conflict with one another. Because there is an intersection here where Canada, because of its geography, because we have people who are in these rural and remote circumstances, particularly, as I said, First Nation, Métis, and Inuit communities that have really entrenched serious health problems that we have to address. If we are the ones driving that innovation and creating those solutions, then that can be deployed not only across our planet, but let's be real, there's a multi-trillion-dollar space industry that's going to eventually happen. And if we're the experts in delivering healthcare in remote places, we're positioning ourselves well there too. So for me, there's an incredible opportunity on a distributed leadership model. Instead of us all fighting against each other, province against federal government, province against province, federal government against industry, to say in this country, look, let's agree on some things. Let's agree that every Canadian deserves access to their medication, that prevention is the answer to a healthy society, that a healthy society creates a productive society that is going to contribute more and both more innovation and more productivity generally. And that what we need to do is work backwards as a team to say, how do we get there? And if we actually had a distributed model that was based on that, then I think we could get there in a heartbeat, and that not only would have huge impacts for health outcomes, it would have huge impacts for our economy, and I think we would be then able to lead the innovations in a very real way that we could export in so many different circumstances and deploy into other circumstances in the world.
Minister, let's focus on some current events, such as how you're protecting Canada's medical supply chain for the coming trade war with Donald Trump. What are you doing?
Well, I think, we're talking logic. I think you talk about science, evidence, data. There are some really important things that we need to work on with the United States. They have massive needs in terms of medicine. We are a potential partner in that and have been. I think when you look at some of the great challenges that are facing us, I think of antimicrobial resistance. We deeply need alignment there. We're dealing with serious challenges with H5N1, and we've been very close contact there. So, we're waiting. Secretary, potentially, Mr. Kennedy is going to be the incoming Secretary of Health and Human Services. I'm looking forward to meeting with him and having conversations. I remember that there's a lot of bluster out there. There's a lot of, any potential division is going to get a lot of attention. It's going to get a lot of headlines. But actually, when you sit down with folks and you have a face-to-face conversation about what the needs are of their country and our country, there is such an interwoven map there of needing one another and needing to rely on the expertise and resources that one another have, that I'm very convinced we'll get there. And I think in life, the only person who really knows the future is, it doesn't exist, right? I mean, maybe a psychic, you call a psychic hotline and you get lucky. But no, like seriously, nobody knows what the future is. So we need to stop casting our mind into all these disastrous scenarios that we're imagining and stay in real time. Because the truth is, Michael, we have no idea what's going to happen in 2 weeks. We have no idea, let alone in 6 months. So let's focus on where we are with what is true, what is data-driven, what is science, have logical, reasonable conversations about mutual benefit and the need to work together. And I think we navigate this. We have in the past, we will again.
Trump has canceled all medical research. After years of drain, are you doing anything to attract a brain gain of American doctors and specialists into Canada?
Absolutely. I think very exciting things are happening in Canada's healthcare system. I can tell you that when I have a conversation with Adriana LaGrange or Uzoma Asagwara, they may be in different parties, but we're talking the same language of prevention and system transformation. And for me, that's where we have to focus on what do we agree on and how can we drive to change it. Because I think when we see this positive change happening in our health system and in making these positive steps towards transformation, and we're really focused on data, science, and evidence, and we're reducing sort of ego and conflict, that becomes not only wonderful in terms of the health, the benefits that we bring to our system, but people want to work in that system. People want to be in a system that's solutions focused, that's evidence based, and isn't based on conflict. And so, I really, you look at this health ministers meeting we're going to have, we're in Halifax for a couple of days starting tomorrow, you're going to see that spirit of cooperation and working together really pervading all of our work. And that is that system of distributed leadership, focusing on what we agree on. It really can be an incredible method of attracting talent and ability, and frankly, getting to solutions. Because I'm not interested in picking fights with provinces. I'm interested in finding solutions. And here's my theory. If I can show something is working in Alberta, or something is working in BC, or something is working in New Brunswick or Nova Scotia or wherever, that when you can show that it's working, people get behind it and they're going to say, well, why aren't we doing that? That's a much more positive way of getting to change, which is to showing something that's working in a particular jurisdiction and shedding light on it and using that as a positive attraction instead of the old game of walking around with a stick hitting each other. People are sick of it. They don't want to see it. And it impacts I would say it impacts culture internally as well. Where, people don't want to work in environments where, the reports you're being asked to write and the things you're being asked to do is getting you some kind of advantage over some other territory, or so that you can show that you're better at this than that person is at that, so you can really get them. Like, that's who wants to work in that environment, right? And health is this is an area we should all agree. Who's being partisan about health, right? It's really simple, because it doesn't matter. Rosalie's talking about, as an economist, what could happen if we unlock the potential of a healthy society, right? And you can look at it from a social justice angle. What does it mean if people who are vulnerable get access to the healthcare they need and they don't get sick? Like, I don't care what angle you come at this from, the answers are the same. And if we are focused on that, not only will we fix things in Canada, but we're going to attract the best talent.
Rosalie, now that you've made it into the studio, we are at the end of our time with the minister, but what is the one thing you would want to say to the minister now that you've got this opportunity to do so, considering your extensive work on the health file?
I think your strategy of going with bilateral agreements, so a coalition of the willing or who wants to try it, is a great strategy. And you're right, the provinces compete with each other. So if one's doing better than the other and it works, then the rest will come along. And I think that's a lot more productive and useful than maybe what we were doing before, which was needing consensus that was never going to come. So, I wish you the best of luck in making more agreements and, taking it as far as you can at the upcoming ministers meeting. And I really appreciate you taking the time and doing the work for Canadians. I mean, we really are all in this together.
We can do it. Absolutely, we can do this. We can have the best health system in the world. I'll go back to the point that I just made, and I think it's so important to remember this. Canada has a huge advantage. We have the second longest health span in the G7. Those are the years we spend in good health. My mom is 80 years old. She's going to, tailgate at Bills games. She's going to the theater. She's having the time of her life. But she just said to me, the best year of her life is at 80 years old. I want that for everybody. That is going to be something that we really need to think about, that if we get this right, we're going to spend less money, we're going to live better, we're going to be more productive, and all it requires is for us to pull in the same direction and really focus on science, data, and evidence.
Well, Minister, I wish you shared with us what your mother's secret is, because I'd really rather not wait till 80.
Well, part of it is living in the moment, being in the day that you're in, living with gratitude. And she is my north light in this world. She's an extraordinary, she's my mentor. She's the person I try to learn from.
The Honorable Mark Holland is the Federal Minister of Health. Rosalie Wyonch is an Associate Director of Research at the C.D. Howe Institute. Thank you both for joining us.
Thanks so much.
Thank you.
For further insight into the state of Canada's healthcare system and what needs to be done to address its shortfalls, visit cdhowe.org. I'm Michael Hainsworth. Thanks for joining us.
You've been listening to the C.D. Howe Institute podcast with Michael Hainsworth. Subscribe on iTunes, Google Play, and Spotify. The C.D. Howe Institute is an independent, not-for-profit research institute whose mission is to raise living standards by fostering economically sound public policies. The Institute is widely considered to be Canada's most influential think tank and a trusted source of essential policy intelligence, distinguished by nonpartisan, evidence-based research and subject to definitive expert review. Visit cdhowe.org and follow us on Twitter and LinkedIn. Thank you.